Hi there. We are the Lactation Nerd Community Health Presentation Group. I'm Amanda Nicholas.
And I'm Rakia Animegi.
And I'm Zion Gibbs.
And I'm Brittany Spearman.
And we're going to present to you our information. Our group has chosen to present to you lactation consultant or lactation nurse. The two terms can be actually interchanged. They mean the same thing. Two of the presenters in our group actually work in women's health services, and we see lactation services used just about every day. The profession actually became defined about 35 years ago, or 32 years ago. In 1985 is when it actually became a actual legal term, and it had a scope of practice, and it had a guiding set of ethical laws. As far as lactation consultants, there's some basic information there's some basic information in which they guide by, and they work for women. They work for women, communities, hospitals, families. All these different groups fall under their scope of practice. The lactation nurse should provide support and advocate for the mother, the infant, or anyone that they're exposed to while providing care. They provide participatory guidance in a range of settings: labor and delivery, postpartum, NICU, lactation clinics, maternal and health services such as like health departments. And they also work in private practices, and they're hired by different families and offices to just come in and provide support. As far as lactation consultants, they would not have a scope of practice without emphasizing breastfeeding. Breastfeeding is important to the role of lactation consultants, because the two are interchangeable. They go hand in hand. You can't have a lactation consultant without having a mother breastfeeding. So breastfeeding is important because it encourages babies' bodies to stabilize after birth. They get better glucose control if they breastfeed. They get immunities and antibodies that are passed along through the mother's milk. They have a lesser chance for ear infections. It decreases the ear infection rate. And acid reflux in babies, which can come from bottle feeding. The breastfeeding actually neutralizes that acid, and they should have a lesser increased risk. As far as for mothers, they also have some benefits from breastfeeding. It increases their caloric burn, so they actually will burn off some of the postpartum weight a little faster. They can actually stabilizes their hormones a good bit better than just the typical postpartum hormone letdown, and they will have a lesser chance for postpartum depression. When mothers are discharged home from the hospital, they should still have a lactation referral or lactation consultant at their disposal, either through the hospital or a private setting, just to have any needs followed up postpartum. There is a hospital in Oklahoma. It was Oklahoma University Medical Center, and they did a study recently just to see how their their patients perceived their care from lactation standpoint, whether they got the support services that they needed. And their research showed them that from an organizational level, they studied 167 families. These were families that did not breastfeed in the hospital and did not plan to breastfeed. 35% of these families said that they felt like if they had better support system or access to a lactation consultant around the clock, that they would have actually breastfeed. So this hospital then changed their practices, reevaluated what they were doing at that time, and implemented a few more lactation consultants at their hospital full time. On the average, only about 31% of people in the United States are breastfeeding exclusively for the first 3 months. This is it's actually about 20% less than what the United States recommends. And on the next chart that I show you will be the CDC's recommendations. About 11% of babies in the United States are breastfed for the full 6 months after birth. And this is actually, it's a pretty decreased number from what we want the standard to be as well. So this chart I'm showing you here is actually the chart from the Centers for Disease Control and Prevention. And this chart was created in 2016, but it's actually data from like anytime from 2006 to 2009 when they came up with the Healthy People 2020 goals. Breastfeeding was also really important to these goals, and their goals are listed here. As far as the baseline goals for the Healthy People of 2020, they wanted a target goal of 81% of babies breastfed ever. Only about 74% of that in 2006 were actually appropriate, and there's still about 10% less from that baseline. Their goal for their target goal for 2006 to exclusively breastfeed for the whole 6-month period after birth was 60%, and we only had 43% in the United States. So as you can see, with a little bit of lactation support, we could actually build these numbers to be the United States standard. I'm now going to introduce Brittany, and she's going to come up and talk to you about her part of the presentation, and she's going to start with question 1. Come up, Brittany.
Thank you for that introduction. So I will be talking about the primary activities that the lactation nurse conducts while in the hospital. So the lactation nurse is also, as mentioned, also known as the lactation consultant. Their job while the mother is in the hospital is to teach both new mothers and experienced mothers how to breastfeed their newborn child. Every pregnancy is different and it comes with its own responsibilities and difficulties. So the lactation nurse offers support and education to combat any breastfeeding difficulties that the parent may be having. Some complications could include latching difficulties, pain, decreased milk production, and even insufficient weight gain of the newborn. The lactation nurse provides a one-to-one consultation and also can provide an individualized plan for each mother. The consultation nurse can also have a discharge plan available and made for that mother before she goes home. The lactation nurse also makes sure that the mother is well equipped before she goes home and able to implement that plan so that the mother is able to successfully take care of her baby and make sure that they're getting the nutrients that they need. So we'll move to the next slide. Awesome. Teaching and learning strategies. The core population that this specialty focuses on is teaching both the new and experienced mothers. Each pregnancy is different, and so the mothers of premature and special needs children often require the most assistance from that lactation nurse. Demonstration and teach-back learning styles are the ones that are most employed. The lactation nurse wants to make sure that the mother feels comfortable and gets the practice that she needs inside the hospital before they're discharged home. They're also required, the lactation nurse themselves are required to have extensive education so that they're very knowledgeable on what they're talking about and so that they're able to tell also the mothers from experience with other mothers that went through. So now Ricky is going to talk about question 3 and 4.
Okay, I'm Reiki, and I'm going to talk about the educational preparation and that is required to function in the role. The lactation consultant registered nurse works independently throughout the community. Many are employed by physician office, lactation centers, or hospitals. Now, while anyone, regardless of education and training, may use the lactation consultant title, the standard in the field is for the lactation nurse to become certified and registered as an international board certified lactation consultant, which is known as the IBCLC. International board certified lactation consultants, they come from many backgrounds. This includes nursing, midwifery, medicine, medical and nursing education, public health, occupational therapy, anthropology, you name it. To better meet the needs of the breastfeeding patient, many nurses tend to hold the title along with doctors and midwives. The preparation requirements for a lactation nurse are set by the IBCLC. There are 14 subjects that must be completed. Of these 14 subjects, there are 8 that have to be completed in health science topics like anatomy and physiology, biology, infant and child growth development, research, sociology, nutrition, and psychology. They must complete also courses in CPR, medical terminology, occupational safety, medical documentation, professional ethics, and safety precautions in infection diseases. There are 90 hours of lactation specified education that must be completed, and the nurse has to have clinical experience as well. They'll also need 1,000 hours of experience working with breastfeeding mothers in the 5 years of the exam. Those who do not have to complete 300 of supervised hours of clinical practice with breastfeeding mothers. The experience includes consulting with women from preconception to the weaning process. Nurses who currently work in the maternity area or participate into an 18-hour training course that's in breastfeeding. Now, also by holding this certification as a nurse, the client can use their medical insurance to pay for their services. This is valid for 5 years, and you have to become recertified by completing continuing educations. The exam is normally taken every 10 years. Other disciplines or professionals that the nurse interact with in this role. Well, it's vital, first of all, that the lactation nurse is thoroughly familiar with normal breastfeeding. As a full partner in the healthcare team, the lactation RN collaborates with all other healthcare disciplines. The lactation consultant registered nurse works with team members with the other disciplines to achieve optimal patient outcomes, and they provide current, meaningful instructions for the client of all ages in compliance with the standard. The women's service is the main department, including the NICU, antepartum, postpartum, and labor and delivery. They also interface directly with the public, physician staff, administration, and other departments. Now I'm going to have Zion Gibb come and present her part.
Thank you. Question 5 talks about what are the necessary skills and abilities required for this role. So in order for a lactation nurse to be qualified, they must be competent. They must do at least 90 hours of evidence-based on breastfeeding. The lactation nurse must also be successfully able to assist with mothers to make them confident with latching, and any difficulties they may be having, they must be able to help them overcome. They also must be able to assist families with decisions regarding the feeding of the children, whether or not they want to do breastfeeding and supplements with different feeds. Also, they must pass the International Board Certified Lactation Consultant examination in order to be a certified lactation consultant. And they must provide follow-up services as needed. Question 6, what was unique or interesting that you learned about this nursing role in your research? With lactation nurses, they're not just a consultant in the hospital, they also have their own offices. So they're kind of like a travel nurse that goes to different homes, and they have to have referrals sent to them from case managers in order to assist with the lactation processes in different patients' homes. They not only help with lactation, but they also help with those that are malnourished, babies that are malnourished, and who are failures to thrive. It was found that breastfeeding interventions using lactation consultants and counselors, they increase the number of women initiating breastfeeding. So the more assistance that they get and the more education that they receive from lactation nurses and consultants, the more likely they are to breastfeed and to give the babies the nutrition that they need. We'll now be having Amanda concluding our presentation. Thank you for tuning in for our presentation on the lactation nurse or consultant. We hope that you have enjoyed this and found information that you didn't previously know. Additional resources can be found at breastfeedingandlactation.com. Here is a list of our references. For any further questions, you can email anyone in our group, and we'd be happy to answer those questions for you. Thank you again.